help the guards to identify, because like you said, sometimes you have to pick and choose the severity level to see who will get what services, in a more on a more urgent basis. So I would try to do many assessments to say, hey, 108 is escalating. You got this many, you want to go ahead and get them some help before this gets out of control, things to that nature. As far as
Can I ask you really quick?
yes.
You sound, as an individual, like you're very concerned and very proactive. How common do you think that is? Do you think that there are a lot of guards that do that, or do you think you were unique?
I think, well, I wasn't actually a guard, I was a correctional officer, but I tried to work. I had a unique situation to where I often served as a bridge between the guards and the inmates, because there is this mentality of don't trust guards, and among the guards there's this mentality of where this inmate is just filthy butt. And I was in a unique situation to where I was able to walk that line between both sets and officer bridge. But what the things that I want to address is to kind of, like I said before, the conversation spends off of too many different directions, is to try to address some things and concerns that have been brought up, so that as we're having this discussion, maybe make some people more aware of things that are being done, some resources that are in place, so that as we are brainstorming, we're not reinventing the wheel for what's already there.
Oh, yeah, absolutely.
Okay. As far as veterans on the county level, which is what Phyllis and I deal with on a daily basis, we do try to get information out. We have flyers in every jail in every county in Arkansas with a description of the Veterans Justice Outreach Program and names, phone numbers, addresses of how to get in contact with us. Now, as far as them not getting their medication on the county level, that's something that we have really been struggling with. The biggest hindrance is Title 38 CFR 17.38. It does not allow the VA to provide any services to any veteran if they're under the care of another government agency. That means if you're locked up in Pulaski County Jail, then it is Pulaski County Jail's responsibility and obligation to see to it that you get the treatment and care that you need. So we can,
that ties your hands.
yeah, and we've been working with the jails. We have some success with the smaller counties, Pulaski County, not so much. But just even to say, this person is already prescribed medication for this condition, if you would contact the VA, they'll let you know. Not so much with the larger counties that have a bigger population, not even so much. Now, what we have been able to do in some of the smaller counties is if they have remaining prescriptions at home, sometimes they will allow the family members to bring it, and the jail staff can administer it to the veteran then. We've had some limited success with smaller counties, just with building that relationship with them. But for the most part, for the larger counties, specifically like Pulaski County, they have a list of formularies that they have. And like you said, it's checking off a box. If the person reports a diagnosis of depression, they have a specific formulary, a specific medication that they're already using. I have one veteran that I'm working with Pulaski County now. He is HIV positive. And as some of you may know, with HIV, finding the right medication is a delicate balancing act, and sometimes it takes a long time in going through several medications to find what's going to work for your particular strain. Pulaski County Jail only has this formulary.
Oh, wow. Well, that's awesome.
And so that's what I'm working with now, providing education and talking back and forth to the medical staff saying, I understand you have this formulary, but this is what this veteran needs. So that's kind of what we're up against, what we're kind of struggling with.
And if I can mention, I know the veteran that was supposed to be here today to speak, he said he actually had to file a federal lawsuit to get his medicine.
A lot of lawsuits.
Yeah, he had to file a lawsuit.
Because there's a statute on the books, and that's
Yeah,
pretty much the only way we went around it.
that's.
About 20% of my time while working for the Max was going back and forth for law, so they file lawsuits. Because that's the only
Yeah.
way to make something happen. You file a lawsuit, lawyers get involved, they start digging their nose into things. The facilities don't want that, because they're already struggling with officers.
So does that bring negative attention to the inmate, or do the guards understand that they have to do
It
that?
kind of puts the inmate in the category of,
Troublemaker.
oh, that's just
Yeah.
Jones. He does this sort of thing all the time, and it's kind of brushed off and minimized a lot of time.
If you file a lot of lawsuits, when it gets higher and the paperwork leaves the facility, there's like, oh, this guy's filing another lawsuit. Not many people actually dig in to see if there was an issue.
Right, look for.
But on the other hand, there's also a lot of inmates that file junk lawsuits. I mean, just because that's all they got. So it's like, 50% of them are bull and the other 50 are actually have legitimate concerns that need addressing. But
And the distinction between the two is almost impossible.
it is.
And you
and it
even
takes-
mentioned about, are there other staff members who care? There are.
Oh, I'm
But,
sure
you
there's
know,
lots that
but
care.
one of the
I
things that kind of got to me personally, being one of the ones who are trying to give extra effort and trying to get their extra attention, you do have some inmates that anything that does not go their way, they're going to file a grievance. And so that's pulling time away from giving the care, because now you have a hearing Tuesday at 3 o'clock and you may be there for 2 hours, you may be there for 3 hours. And so it kind of gets frustrating, because you're doing what you can, but like I say, in one unit alone, there's 108 guys, and you have to walk to each individual cell, where if I'm only on 69 and the guy on 86 is yelling to me, and I'm getting there as fast as I can, but because I didn't leave what I was doing, no matter what was going on with this guy, then now I have a grievance file. And then that happens more so to officers, and then it does get to the place where the officer feels like, I'm going to deal with this guy as little as possible, because anything that doesn't go his way, if he asks for an extra syrup at breakfast and I don't have any on the card, then I get a grievance file, and so.
Can I?
There was a-
For just 1 second.
Let me, on the topic of meds though, Phyllis, from your perspective from Garland County Jail there, because it is the only facility in the state that has a veterans pod, could you talk on the med issue itself? Does that resolution of the med availability, does that work any better at Garland County?
I said it's going relatively well. It's about building relationships with there, and there is a release of information form that the veterans, that the nurse can fax to the VA and get their list of meds. So in Hot Springs, it's been working out really, really well. In Jefferson County, it's taken a little bit longer, but we are now working and it's going relatively well. Does it happen overnight? Does it happen within 2 weeks or 3 weeks? No, it doesn't happen. When I go to, and it's working really well, I think, at Garland County, because we have a veterans pod. And guys, and that's another thing too, females are saying the guys have a pod and they don't. So we're working, that's another issue too. But it's going relatively well, I think, at this point. Now, in terms of when there are veterans there with severe mental health challenges, the jailers tell us immediately, Ms. Wilkins, we are not equipped, we are not trained to handle inmates who have severe mental health challenges. And it's really sad. They keep them, I know in Jefferson County, up front and in the cells there. And it's just, I guess the jailers do the best they can in trying to keep them safe. That's another whole issue. Mental health petitions, trying to get them to where? The state hospital. It takes a long time. We have mental health providers that are contracted that have contracts in each county. They come in, do an assessment, but is the state hospital, are they backed up? Yes. So veterans, everybody else, they wait a long, long time trying to get in there. So that's another issue that we deal with.
One of
So
the things
when
that
you say veterans pod, do you say they have a veterans pod?
Yes.
And what is the specific, when you say veterans parks, are they getting some type of different treatment? Do they get?
They're in a pod all by themselves. They have television, they have microwave, they have coffee, they have access to a phone, and it's just only veterans in there. And,
Do they generally get the?
they get meds,
Okay.
yes. And another thing I found too, veterans have this relationship, and so they take care of each other. When I'm in talking with one veteran, I go to Hot Springs, to the Garland County Detention Center every week, every Friday. And when I'm in talking with one veteran, they'll say, Ms. Wilkin, this veteran, he wants to come to see you because he has such and such issue. He's already advocating for that veteran. I said, well, okay, I'll see him. You know, I can't talk about what's going on with him with you. But they're already advocating. Can you help him? He's going to be getting out in a couple of weeks, you know. And one good thing about our homeless program is we have an outstanding outreach program. And, you know, we go all over looking for veterans that are homeless. Also, when they get ready to come out of the jail, excuse me, I have a cold. That's the reason I'm sort of isolating myself. When they get ready to come out of the jail, and we have Veterans Treatment Court in Garland County. So I've already done an assessment. When they get ready to come out, I tell them they can come directly to us, and we provide housing, we provide jobs, we furniture, we have residential treatment for them, the St. Francis House. When they come to us, we take care of their needs and also provide case management. And that is so important when they are getting out of jail, that they have someone to help them with those decision-making skills.
And I do co-sign that, because
And
it made a difference in my country.
Can I
That
ask,
was the
you
other
said
thing.
that's in Garland County?
Yeah.
Is that happening anywhere else, or is that strictly just for Garland County?
It has only happened in Garland County. Would I like for it to happen in other counties? Yes.
Yeah.
The reason that I think it happened in Garland County, they were building a new jail. And so in that process, we were talking about veterans and what could we do?
I remember that actually coming up, and I remember that in the planning stages.
Right.
And so I'm so glad to see that it's working and successful. That's awesome.
It's the only one in
Judge
the,
Schweitzer was very instrumental in that. He is no longer with us. His daughter is the judge now, Judge Breslin. She's taken over his seat. And she has taken on that level of empathy and being an advocate for our veterans. And it's working out really, really well.
That's awesome.
if you ever want to Google online, Veterans Prison Pod or jail pod for veterans, you'll find that there aren't a lot of them. Washington State prison system is like the gold standard, and it's very interesting to read, to see the write-up. But I can tell you what was very interesting, and that which down in Garland County, they didn't realize when they established that program there how unique it was until the Democrat Gazette contacted them about a story. So it is it's online, and it's in the papers as to what was written on it. But it's one of those cases where Arkansas was not necessarily in the last place on an issue. This is one where Garland County on its own took this on, and the VJO, or Central Arkansas Veteran Healthcare System's Veteran Justice Outreach Specialist, or Miranda Watkins before Phyllis, really was really instrumental in making that happen.
That's wonderful.
I just got a two-part question. It is for both y'all and you too. I mean, this is so successful in Garland County. What do we need to do, just from the veterans community, to start doing this in other counties? And then, if it proves successful on the county level like this, why not do it at the state level? Why not? I mean, I don't know if there's any closed down prison facilities in the state. I'm sure there's something somewhere, but why not have a veterans prison, just for veterans? I mean, is there any?
Put it on the list, Richard. I mean, we're starting the next 2-year cycle. And
What's the process?
that's what it takes, and, I mean, those are, one of the reasons I brought it up is for that very reason, was to find inspiration within the veteran community to add it to our strategic plan process, so that we have 2 years to work out some of the details for what it is and how it would work, and what's the funding stream, what are the pros and cons. There are different issues at the county level than there are at the state level. But at the end of the day, if you start the conversation out with recidivism rates, that's where you start the conversation out. I think you'll find that the veterans who have moved out of the system are in a much healthier place. And if you're able to lower recidivism rates, that's a big deal. And you can't spend saved money. That's one of the things. People oftentimes think, well, I'm going to save money through this program so I can spend it over here. Well, it doesn't work that way. So you actually have to work through another mechanism to do that. But Garland County figured it out all by themselves. So it's something that could be replicated elsewhere. Do we need 75 of them? Probably this doesn't work. In fact, not all the counties have a county jail. But having a conversation from our community focused on things that we can learn from Garland County, as well as from Jefferson County, the things that our VJOs, actually, it's a very small group of people right now with Andre and Phyllis and Ricky are the three people who do 49 counties of work.
Well, I remember when the ADG ran the story, and we brought it up, maybe at the Veterans Coalition, maybe in this group, but I remember talking about it then. And I mean, I'm just wondering, are there groups advocating for it right now? Is anybody going to Doc Holliday and saying, hey, we need some more?
I can kind of answer that question for you real quick.
Okay.
I ran into Doc Holliday a while back, just talking with him. And I don't know whether you know Steve Azell or not. He's our disabled veterans rep. I work for the Department of Workforce Services. I'm the intensive services coordinator here across the street. And I help disabled vets also. I help a lot of the vets that are coming back from incarceration and whatnot. Try to help them with resume writing, job placement, that sort of thing. But another thing I did when Steve Azell, our disabled vet rep down in Garland County, was working also with the Garland County sheriff with the veterans pod, I happened to mention that to Doc Holliday, and he goes, can't do it. I said, why can't you do it? He goes, overcrowded. He said, we're booked to the max right now. He said, for every prisoner we let go, 2 more take your place. So, and that's the biggest thing right now. Yeah.
Well, I know in Jefferson County, it's about contacts and relationship building. It takes a lot. Just for Jefferson County, I talked with the sheriff, Sheriff Gerald Robinson, and he's a veteran. And I said, what can happen? How can you make this happen where when veterans come in doing booking, they can be identified there? And then when I come to the jail, you have a list or log for me, and I can see those veterans. Sheriff Robinson said, I can make it happen. And he made it happen. Will other sheriffs do that? It just depends. We can't go in and make them do it. It's just sort of like judges who want to do veterans treatment courts. It's no law that says that the judges have to do veterans treatment courts, drug treatment courts, or any of these things. It's because they have empathy and they are really wanting to help veterans. Right. And in terms of change and making not only their lives better because they have served our country, but looking at their children and families, that's a major impact. So the judges that opt to do it is because they have a heart for it.
Yeah.
Phyllis, it sounds like judges and sheriffs are 2 key people in this whole system that need to be advocated with.
Well, and we're going into the next cycle. and I would say, Richard, to your point, and Dr. White as well, we were very, very successful in the session that just completed. And if we keep our issues very tight and very focused on a subject matter area, so we're not picking off all over the place. But this meeting today, 2 days after the session ended, is near perfect timing to bring some congealed thought that includes the VA perspectives as well as the veteran community perspectives, so that, Richard, when you stand up and say, are there groups advocating for that? The Veterans Mental Health Council is a member of the coalition and has an opportunity then to nominate issues within the sphere of the interest of the council towards what the coalition goes forward. And I would suggest already veterans treatment courts as well as veterans pods ought to be a topic of conversation starting now, not waiting around till January 2015 or 2019 to bring it up.
And can I say, I agree with you 100%. You got to get the buy-in from those people. And one of the things that Dr. Koo has done, for those of you who don't know Dr. Koo, most of you know who Dr. Koo is. If you don't know our wonderful, loving Dr. Koo, who is all amazing, he has already reached out to the director of the prison system for Arkansas, and that person happens to be a veteran. So that is huge in our favor, and we are going to start having meetings. We've got these 3 things lined up for this month, but we're also working with that director to see if we can start having meetings with the corrections officers, the wardens, all of those people. So part of gathering the information here and learning what the issues are and getting the feedback from all of you on what is needed and what would be a great idea, part of that is so that we can create this training and this packet, if it's a packet or whatever the case may be, so that we can go then and do trainings that are veteran specific to the correctional officers and the wardens and everything else. So that's something that we have in the planning stages.
But let me, and Andrea, what we have talked about here is, Phyllis has talked about it, Andrea's talked about it, is the relationship that is created between the VJOs and facility management for the most part, as well as, again, Toby's relationship with the justices. And in many cases, from the outside perspective, some of this is like pushing a spaghetti noodle, and that you only go as far as that individual wants to go and feels committed. They will tell you that you can't legislate this because they don't want you to legislate it. So they tell you, we're not able to legislate this. Well, you can legislate everything. And if there is a law on the books, now that gives that individual reason, whether it's the prosecuting attorney, and that's, Keith, having you here as listening ears for the AG. The AG is on board with all of the things that we're talking about here. She's been very supportive. The very, very first conversation I ever had with the AG before she was elected, I tried to talk to her about veterans treatment courts, and she let me talk for 5 seconds. And then she said that the most important thing about veterans treatment courts are they save lives. So she's passionate and supportive, and I know that she'd be on board. But prosecuting attorneys, the justices, the courts need to be on board, and the sheriffs. The county judges help too, because they work for it, but they're both elected officials. So the sheriffs themselves are, but with a Sheriff Robinson, as well as the sheriff that's down in Garland County, they are thought leaders. They are future leaders in that community. And that what we've learned from him, yeah, you may need to export it to get it down to Hempstead County or to Joshua County. But every one of those relationships, that once they buy into it, and we find a solution in this next 2 years as to how to do pods or how to do veterans courts, things that Andre and Phyllis and Ricky do, is incredible hard work. But I would tell you that looking across the region, Arkansas's The Central Arkansas Veteran Healthcare System's 3 VJOs are the busiest VJOs in the country. And that's something we can be thankful for. Of course,
If I could, I want to get us back on topic. That is our next step, is what we do forward. We want to go back to learning what the issues are. So we have another veteran here who has some experience they want to share with us, and then we'll go back to you, Andre. And then we also need to touch, and we're kind of running out of time. This has been such a good discussion. So then I want to come back to you, Andre, and then I need to come to the benefits office, because the benefits office has some important information that they need to share that we all need to learn too. I'm going to send around this notepad for you guys to sign up with, put your either phone number or email address. Let's create a committee that wants to work on this, Dawn. And if you could put your information on here so that we can use you as a resource, and if you could help with this committee, that would be wonderful. But let's start a committee that starts working towards that legislation and getting those bodies to work together, and whatever packets we need to make for the veterans. So I'm going to pass this around, and if this is something you're passionate about, if this is something that you're passionate about, if you could sign up, and then we'll create this committee that will start working on this specific project. So I have a veteran here who does not want to be identified, so I'm not going to mention name or where he's from or anything like that, and he is not to be on camera. We can get the audio.
I closed the lens cap.
Oh, perfect. Okay, so we'll have the audio for you. So we want to hear from this veteran and his experience, because he's got a really good story to tell as well that will help us understand some of the issues. Go ahead.
Well, thanks for having me here, and I'm pretty sure the FBI has pretty detailed files on me. They know my name. That's a joke, but they really probably do. So I'm a U.S. Army veteran, and about 2000, trying to condense a decade into 5 or 10 minutes, about 2000, I want to say 9-ish, actually going back, 1999, I joined the Army, and I was very motivated, and I signed up to try out for the Rangers, and I went through airborne school successfully, and then I went through some Ranger training to try to make it into Ranger Battalion, and I hurt my knee real bad, and I was medically